Good afternoon, everyone. I'm going to give a brief overview introduction of the session while people are logging in. So thank you for attending. And if folks don't catch this part, we can always catch them up during the presentation portion of this roundtable discussion. So today we're going to be talking about observational methods in education research. And I'm Sandra Soliday-Hong, Senior Research Scientist at the FPG Child Development Institute at UNC Chapel Hill, and I will be moderating the roundtable discussion today. We're going to focus on the benefits, challenges, and promise of the use of observational methods in education research. And our panelists will present on their funded projects that build upon 20 years of IES-funded research that utilizes observational methods within the context of quasi-experimental and experimental studies and explores future directions for the use of these methods. For our panelists, we have Terry Sable, who's joining us from Northwestern University. She's an associate professor in the School of Education and Social Policy. Amanda Williford, who is a professor of early childhood education in the University of Virginia Center for Advanced Study of Teaching and Learning and the Department of Human Services. Jessica Steinbrenner, who's an associate professor at UNC Chapel Hill in the Speech and Hearing Sciences Department of Health Sciences, and she's also a faculty fellow at the FPG Child Development Institute. And Ann Sam, who's a senior research scientist at FPG also, and at the University of North Carolina at Chapel Hill. So thank you for joining us. To provide an overview of the session today, we're going to begin with 5-minute flash presentations from the panelists about their use of observational methods in IES-funded research. And then we're going to spend some time, about 15 minutes, engaging with a discussion with the panelists about the benefits and challenges of using observational methods in their research. And then we will also have a discussion with our panelists for the participants in the group, for a group discussion with people who are attending the session. We have decided to change the order of those discussions so that we'll do the moderated portion of the discussion toward the end and provide an opportunity for group discussion and questions following the flash presentations. So that's an update to our roundtable schedule. So now I'm going to hand the slides over to Terry Sable, who's going to give her 5-minute flash presentation.
Thanks, Sandy. Hi, everyone. I'm Terry Sable and delighted to be here to present our work from our study titled Moving Beyond the Average, Building a Comprehensive Model of Classroom Quality that Incorporates Children's Individual Experiences. Thanks. So when we conduct work with observations, there's lots of different lenses we can take. I was personally trained in kind of thinking about classroom level observations and kind of what can be observed when we kind of do kind of a broad lens of observing the interactions within a classroom. But of course, we know that not all children are having the same experiences even within the same classroom. And so there's great opportunity to kind of zoom in on children to try to understand their individual experiences within those settings. So for our study, we took advantage of a measure called the Emerging Academic Snapshot, in which observers went into a classroom and would zoom in on one child. So let's say that cute girl in the blue dress, who happens to be my child. We would zoom in on her and observe her for 20 seconds, and then the coder would observe for a code for 40 seconds. So it happened super fast. And it was coded about engagement across a bunch of characteristics, including academic engagement, the extent to which they participated in art or physical play, or the extent to which the child was not engaged. And so what we were trying to do is take advantage of these tools that have been used across a number of large-scale studies listed below to understand how children's observed engagement, what that meant for their child outcomes. So one of the nice things about this study is that there were multiple classrooms with lots of children nested with, or with 4 kids nested within those classrooms. And so this allowed us to really kind of understand, get a nice broad landscape, at least in the first study, to try to understand the extent to which we observe, so could sort of understand what children's engagement looked like on average. So basically just pooling those kids across all of the different classrooms. And for our child level analysis, basically just account for the fact that those kids are nested within classrooms and are nested within studies. So but really our ultimate question is about just average experiences across kids. And basically what we find is that a lot of our kids had no engagement, which was of any kind. And about a third of sort of those snapshots were with academic content, and about a third were with art or physical or fantasy play. And so we started thinking about what is it at our core that we really care about. And what we decided was really about having sort of sustained engagement across multiple snapshots. And what we found is that about 2/3 had sustained engagement within those sort of snapshot cycles. So it's an example of, with these observational tools, sometimes you're sort of limited by variability. And so we had to be kind of clever about how to kind of maximize variability in a way that we felt was aligned with our developmental theories of change. And lo and behold, that sort of sustained engagement within that HLM model was related to kids' literacy and math skills. This is the flash part of it. Our second study then basically said, well, actually what we have though in our design is we could actually look at the extent to which kids, even within the same classroom, are having differential experiences. And so we basically take advantage and compare using a design called classroom fixed effects, where we basically are kind of netting out all of the variation that exists at the classroom level and trying to understand the extent to which, child 1 and 2 differ from child 3 and 4 in their engagement and what that means for their development. And what we find is there actually is, like, one important question just descriptively, is there actually is variation in how much kids are experiencing academic content, even within the same classroom, right? They've got the same teacher, but we find that there is a range in terms of how much engagement they're having. And in turn, that engagement is, even within the same classroom, that engagement is associated with their gains in literacy skills and math skills. And so what our work is kind of pointing to is just the importance of sort of unpacking the average within classrooms and sort of not assuming that all kids are having the same experience in the classrooms, and potentially kind of ways in which we can kind of capitalize that while recognizing all of the time and cost constraints that happen, which I'm sure we'll talk about in the Q&A, and I'm sure Amanda will talk about in her work. So thank you so much.
Hi, everybody. I'm Amanda Williford, and I'm excited to give you a little bit of a teaser around our LOOK teacher consultation model. So this is an intervention that has been funded by IES for quite some time. It started with a development grant where we developed this early childhood mental health consultation model. And we are now just wrapping up our 3rd year of an efficacy trial. So very quickly, I just want to thank my colleagues and co-principal investigators, Jason Downer at the University of Virginia and Rebecca Shear at the University of Miami. And in particular, I want to thank Rebecca and her team at UM, because they have led the data collection of this efficacy trial. We're wrapping up cohort 2 right now, and it has been just a major, major endeavor. And so I am in deep gratitude to her and her team. Next slide. So what is LOOK? So LOOK is an early childhood mental health consultation model that we created to develop teachers' competencies, to promote children's social emotional development, and for teachers to be able to understand children's behavior in context. Next slide. And so what makes our early childhood mental health consultation unique in our view is this focus on observation. So given our work around and our research around conducting observations in terms of kind of understanding classrooms and children's engagement, what we really wanted to do here was focus on improving teachers' abilities to conduct observations and use that data. So we want teachers to be able to observe children's behavior in context, and use that observation to implement strategies and understand children's responsiveness, to be able to analyze their own observations in order to select strategies for a particular moment in the classroom, and to also use observations to be more aware of how they can impact children within the classroom. So next slide. So we have three major kind of formalized assessment measures. One is the Adjustment Scales of Preschool Intervention, or the ASPE. So this is a teacher report measure or a rating scale, but teachers report about children's behavior kind of within the context of the classroom. So it's a little bit different than just a frequency measure of behavior. And then consultants use the Individualized Classroom Assessment Scoring System, or the INCLAS, and that is a global kind of measure of children's engagement, positive and negative, with teachers, peers, and tasks. And then consultants also observe the classroom using the Teaching Pyramid Observation Tool, short form, or the TPOT-S. And that is an observation that looks at teachers' use of proactive social, emotional, and behavioral practices in the classroom that are aligned with the pyramid model. And these, can you go back? So these three assessments are used kind of formally 3 times across the year and put into an assessment reporting system, and consultants and teachers kind of look at all of the data across all 3 of these measures and kind of make a plan. So what is it that you're seeing about kids in the classroom, and what strategies do you think might be most effective, and kind of that, and then we kind of do that in the kind of mid-year and at the end of the year. Next slide. And then across the year, we kind of use what we learn from those assessments in a more formative way. So there is a consultation cycle that happens every other week across the school year, where teachers decide what they're going to do in the classroom, act upon it, and videotape it. Then the consultants and the teachers kind of look at that videotape and analyze what they're seeing, both in terms of child's engagement and what's happening in terms of like what teachers are doing or what strategy they're implementing, making a plan around what they see in that video analysis, and then kind of doing that again back in the classroom, implementing that plan, videotaping again, and then repeating that cycle across the school year. All right, I'll hand it over to Jessica.
Hi, I'm Jessica Steinbrenner. Happy to be here today, and I come as a fellow learner, so looking forward to our discussions after this, but also someone who's worked on fidelity of intervention across probably 4 different studies, kind of ranging from preschool to high school with students with autism. And so if we go to the next slide, I sit on the shoulders of lots of other people, many of whom are listed on this slide, that I've read their work, or some of them have been consultants on our project, but also had the opportunity to work with a lot of great colleagues around this. Sam Odom, Kara Hume, Laura Hall, Stephanie Reshko, Linda Watson, Brian Boyd, and Ann Sam. And they have, I think, helped shape the field and our work together and my own perspectives. So just getting us on the same page when thinking about observational measures related to fidelity of implementation. I think the field accepts that this is a multidimensional construct. And so we're trying to think about things like adherence and exposure and quality, responsiveness of the learners, and differentiation. We've also viewed this as multimodal, so observation is definitely a big part of it, but we're having to pull in stuff from interviews and artifact reviews and questionnaires, and this spins really nicely off of what Amanda just shared as well, I think, of using kind of multimodal perspectives and also multi-informant perspectives. So a lot of our interventions are team-based, and so figuring out who we're observing in the classroom and how we're splitting those observations across team members, and thinking about kind of who we're interviewing, gathering questionnaires from as well. And so leading into that, kind of in the spirit of the roundtable discussion, I have two current projects where we're trying to conceptualize fidelity of implementation, and thought I would talk about some of our major areas of discussion that we have around observation related to those, and the key points that have come up, and kind of some decision points and challenges and solutions. The first is around observational procedures. And so depending on whether you have more of a comprehensive intervention model that's classroom-wide or school-wide, or something that's more of like a focused intervention practice or supplemental, maybe being layered in, we've had different challenges for thinking about how those observational procedures will work. But we are trying to see kind of the breadth and the depth of the intervention. And so we've thought about things like doing interviews ahead of time to figure out when we can observe, making sure that we're being flexible and trying to see kind of the best of what they have to show us, but also like a realistic picture of the day-to-day. So with that, we've also thought about multiple observation points and thinking about how often during the year do we need to see this. Sometimes we see kind of like an up and down trend in some of the data. So the second point is the active ingredients. I think this is especially challenging in fidelity of implementation, as well as oftentimes, I think these are a moving target. We're kind of discovering what the active ingredients are along the way in measuring fidelity of implementation and relating that to the child outcomes. And so we obviously start with a solid theory of change, but have to think about like whether that's within a grant or across grants, what we're measuring that's picking up on what's actually making those changes in the child outcomes. And one of the challenges we've had around active ingredients too is with our supplemental interventions is just trying to differentiate, okay, what's some solid, like kind of what are the baseline practices that are already happening in the classroom, those foundational pieces, and then what is this intervention and how are we differentiating, observing those two aspects. And so that leads into thinking about items and scaling. And so we've thought about having, you know, different pieces that are capturing maybe some of these facilitating features versus some of the key ingredients of our interventions, and challenges around keeping those items measuring like a single aspect of the intervention, making sure that our scaling is simple enough to score reliably, but also broad enough to actually capture differences in the classroom. And so we've currently kind of landed on like 3-point item or 4-point item rating scales where it's functionally kind of a no, partial, yes. And also having to supplement some of these items with interviews. So maybe there's pieces that we're not always going to see every time we observe in the classroom. So how we go back and get that information in a systematic way. And then finally, another challenge in research studies is just that we know that we need experts in the interventions to kind of score this well, but also seeing the value of maintaining naive observers. And so we're trying to troubleshoot how that works in the context of a research setting. We're, you know, working on certainly making these fidelity of implementation measures, providing more concrete definitions for each of the rating items, and having these examples and non-examples to make sure that we can be more reliable in our scoring. And I think in general, what we find is I think fidelity of implementation has at times maybe been a bit of an afterthought, but really truly it's kind of the most proximal measure of a lot of the work we're doing in PD. And so just figuring out how to make that a more essential part of our research process, and how to validate that measure in the context of these kind of like, you know, moving from development studies into efficacy studies, and how we make sure that we're using tools that are reliable and capturing what we're aiming to change in these classrooms. And I will hand it off to Anne.
Great, thanks, Jess. So my name is Ann Sam. Thank you so much for coming to the last session of the first day. We really appreciate you all being here today and look forward to our discussion coming up. So I will be talking about a project that recently we finished. It was a development project for supporting paraeducators and using evidence-based practices for students with autism. And so I just want to acknowledge my colleagues, Dr. Sam Odom, as well as Jessica Steinbrenner was also on this project with me and was instrumental in a lot of the work that I'll be discussing today. And so moving from the fidelity of implementation that Jess was talking about, we are really focused, we're interested in the fidelity of specific evidence-based practices, because this project focused specifically on how do we increase the use and fidelity of evidence-based practices for paraeducators working with autistic students in the elementary setting. And so we know that the better fidelity we have, the higher fidelity, we have better student outcomes as well. But there's this lack of tools to measure adherence to and maintenance of implementation of evidence-based practices. And so that's really what we were interested in. And going to the next slide. Thank you. So this project focused specifically on 5 evidence-based practices. And you can see over on the right-hand side, one of the ways we were measuring fidelity. This is for the practice of reinforcement. And so we measured fidelity in 10 to 20-minute instructional sessions that a paraeducator would have with a student. And we were able to observe whether the paraeducator was doing these things during the session. But one thing that we were also interested in is what was the generalized use of these 5 evidence-based practices that paraeducators are using, we were using for professional development. Were they using them in other settings? How often and in what quality were they using them? And so going to the next slide, we were interested then in developing what we have called the EPP use observational tool. And so our team engaged in an iterative process of developing this tool, and you can see the steps here. The first step was the initial development process, where our team worked together to draft an initial coding manual. And in the coding manual included things like the coding system, the rules and definitions of the 5 foundational evidence-based practices. We then tested it using videos we had collected from classrooms, and seeing, were we able to capture these elements from our coding system in these observations that we were seeing. And based upon that, we then had team discussions and adapted the coding manual further to then pilot the measure in classrooms with paraeducators. So here you can see the EBP use observational tool. And so it was based on a partial interval coding system. So we observed for a total of 2 hours in length. And so we wanted to see a broad context of where paraeducators might be using these practices. Was it strictly in instructional sessions, or was it across the day during more leisure activities? And so you can see in the back page, you can see the partial interval coding system, where for each of the foundational practices, we would observe for 2 minutes and then have a 1-minute recording time, where you simply selected whether the practice was used during that time point or not. And then the location, as well as what was the instruction that was happening. Was it academic, non-academic, or leisure? And then we wanted a metric for looking at quality of when these evidence-based practices were used across this 2-hour time span. What was the quality that we were seeing? And so you can see that on the first page here in the forefront, where you can see the steps of the implementation for the different practices, as well as a 5-point rating scale about whether one was very limited use of these implementation steps to 5. So we piloted out in 20 classrooms, and we were able to see variation from those. And so for our future use, we are really hoping to use this measure again as more of a pre-test, post-test measure, where we're able to see at the beginning of the year, what does it really look like? How are paraeducators using evidence-based practices, and what does the quality look like? And then use it again at the end of the year to see change based upon a professional development model. Okay, so I'm going to turn it back over to you now, Sandy. Thanks.
And thanks to all of our panelists for sharing about your work using observational methods. We are switching our order a little bit. So we're going to pause now to have some discussion with the participants in the session about some of the topics that have come up during the flash presentations, or perhaps about your own work. And then if there's time following that, then we'll do a little bit more of a moderated panelist discussion, but we wanted to make sure that we had time for this to be interactive with our participants. So the first question I have for folks who have joined our session today is, what questions do you have for the panelists about their use of observational methods? And you can either put it in the chat or unmute yourselves. I know we've just given an introduction, so we'll give you a minute to come back to these two. Here's one that I know there are several folks, at least, that I've looked through the participant list, and probably many more. Are there examples of use of observational methods in your own research that you'd like to share with the panelists and with our participants? Thanks for jumping in, Jason. It's not easy to do in this format, and I appreciate your patience with the Zoom, little bit of awkwardness with Zoom. But Jason Downer says, I'm curious about the observation of evidence-based practices. Is this a tool that could be used across different intervention programs? And I'll hand it to Anne for this.
Yeah, thanks, Jason. And I'll also let Jessica, you can chime in too if you have things that you want to add based upon what I say. So this was focused specifically on use of EBP. So it was looking at foundational practices such as prompting, time delay, visual supports. And so I think if your intervention was using those components and we're targeting that, then it would be something that could maybe be used, because it wasn't specific, it's looking at the specific use of those practices. So if it's included in your broader intervention, then I do think you could perhaps use it for that. Jessica, anything else to add?
I don't think so. I think, yeah, it's a nice system. I think especially just being able to get the frequency of use, because that's one of the things that we struggle with, is how much it's carrying over into kind of generalized use.
And for generalization, and I didn't mention this, but we did see very limited use of evidence-based practices. We didn't go over the results, but it was very minimal.
I also see some questions coming into the Q&A, and we've got a question from Tasia Bradford. For an early career researcher, what is the biggest lesson learned for observing classroom instruction? And I will hand that to Terry to start with, if you don't mind, Terry.
Well, it is time consuming and expensive, and those are real trade-offs. And I see a question about AI, right? Like there's, going in and observing classrooms is really expensive and time consuming. The good news is, like, our research was relying on secondary data that had already done the hard work for us. And so there are lots of data sets that exist at ICPSR and other places, especially with sort of this movement to open access for data, where you can rely on those to start, puzzling through some of the descriptive work. But, as a developmental scientist, I would be remiss to not say that we have to get in there to figure out what's going on, right? So, moving to questions of, instead of does it work, but how and why it works, I think are the core questions we're kind of facing as a field in many areas. And so, I encourage you to get in there, but maybe be savvy about when and how.
Great answer.
I'm happy to add, just in thinking about, like, as a new researcher, I know the very first IES grant that I got was looking at children who teachers reported were displaying the most challenging behaviors kind of in the classroom. And we had a really, really intensive live observation protocol where data collectors were in the classroom for, 3 days in a row, observing kind of 3 kids at a time. So many hours and many cycles of data. And we did not see a lot of negative behavior. We just didn't, like we saw, there were many, many cycles where they weren't. And that was a question that we had. And, in some ways we went back and we have not solved this even now, I don't think, but really thinking about what that data meant. But I'll also say that in our analyses, even though there was very low frequency of that behavior, we did find things predict to it. So it was meaningful, even though it was not very frequent. So I do think it's just the understanding, just like Terry said, like understanding what's happening in classroom is really important. And also, like, just because you don't see it often doesn't mean that it's not a meaningful piece of data.
That's really helpful advice. Sometimes there are things that you're really interested in that are just low frequency, and observational methods can be helpful, but it depends on how intensive they are and if you're catching the right time for those behaviors to be observed. I'm going to combine, I'm going to ask a clarifying question after this one, but first I just wanted to give a chance for the panelists to respond to a question about the use of artificial intelligence or improved efficiency with, I think, both the observation side, but also analysis, and dreams of ways we could do that more efficient while maintaining reliability or rigor. Is there anyone that would like to jump in, or else I can ask someone?
I guess one thing that jumps to mind, I think this is amazing. I hope we can find ways to capitalize on AI to do this. One of our bigger challenges is thinking about videotaping in classrooms. Particularly, we're working with kids with autism that may be a subset of the students in the classroom. And so I do think in some of our districts recently, we've had a pretty big shift. This also goes to another question around how do you do IOA when we do it live. So there are some challenges, I think, with just getting video permissions related to this that could limit, I'm guessing, the use of AI, but I don't know all what's in place from like an IRB and security perspective related to that. But it would be amazing if we could cut the costs in some ways and make this more feasible.
That's right. And it also gets to the next question about recording systems, which I think could be the recording system that Anne showed in terms of like a recording format on paper or an electronic data collection system. But it also could be like use of video or other things that are, spatial kind of measurement methods. So if you can speak to that next, Anne, after you answer if your observations were in person or virtual.
Yeah, so we've done a combination of ways of looking at fidelity. So for the first form that I talked with you about, that was looking at specific reinforcement, evidence-based, fidelity of implementation. Those we have like video recorded because it's usually just one student, a para, or small group of students in a para. And then and that's really to help blind and keep the rater naive to the condition too. And then we've also done live coding, which is what happens with that second form that I was showing, where it was a 2-hour observation. Those were all done live, and we did the IOA of those live as well. So it definitely makes it easier logistically if you're able to collect those measures. I mean, if you're able to collect video and then code it at a different time point. But if you're not, like for some of the measures, like it's just impossible when you're doing day-long observations or several hours, that they really need to be live. So it's a tricky balance in that.
Yeah, thanks for sharing some of those considerations and for the format. Next,
Sandy,
yep.
Sorry, can I circle back to the AI question? Because I think it's a really interesting one. And I have considered it. And I will say that there are other folks, like there are folks in like computer science, maybe there are folks on the call, who are really pushing the field in this way. So there's like something called Talk Back, where they basically like automatically code like the sentences between teachers and students, and they think about like accuracy and pressing for reasoning. So there are advances being made in this area. Like there are other ones about like looking at how much time a kid spends with the teacher, right, to kind of get this like more blunt measure of engagement. I think, there's so many people here, I think this is gonna, there's lots of opportunity. And I would also just think that we need to be cautious that we sort of maintain still sort of our theories of change and not sort of let the technology drive our questions, but the reverse. And that, a lot of this AI is prone to many of the same challenges of observational tools. It's not like it suddenly fixes many of the biases that are baked into measurement. And so I think there's promise, but it also, I think there's lots of concern that we probably should continue to have conversations about.
That speaks to another question in the chat, Terry, about the degree to which capturing the experiences of diverse learners, and I think introducing bias is something that you mentioned. Understanding that some children may have a very different experience than others within the same classroom. And I think our study speaks to that, Terry, if you want to address that question.
Like the question about just sort of the varying experiences kids are having in the same classroom. Yeah. And like, and the reason,
are we capturing it?
And are we capturing that? Right. And so especially if AI comes in and sort of makes these like assumptions, and then all of a sudden we're left with a bigger mess than we started with. But, I think the premise of our work is rooted in these ideas that right now, when we kind of take these broad measures, and I know they're rooted in Jason and Amanda's work too, like, when we kind of get a broad, understanding what's happening in the classroom, we know kids are having different experiences, whether that's the function of their temperament, their behavior, their demographic factors, like they're all the things, right, are ways in which those relationships with teachers might be affected. And so when we potentially kind of miss those experiences, we're missing kind of opportunities to promote equity in the classroom based on those characteristics.
I want to thank Dr. Lopez for asking that question, because it's really important. And I wonder if Amanda would like to speak to that as well.
Yeah, I think that's right. So in part, we developed Look, and with this focus on kind of teachers observing in classrooms, in part to kind of reduce the bias of like low incidence, but like highly relevant kind of disruptive behavior that kind of created kind of a salience around a particular child, right? If a child bites, that's a highly salient, but oftentimes very low frequency behavior, but then it shapes the schema. And so thinking about an observation of a child in which you can kind of see across a day a very kind of varied experience of a child's engagement. But what I will say is that like this, what sometimes I think gets pitted against each other is like teacher report versus observation, that somehow one is more truth than the other. And that is absolutely kind of not true. They're different pieces of information. And also this idea that like, two people can watch the exact same video and see or observe very different things. So, an observation doesn't take away bias. Like we have different lenses for which kind of bias is kind of baked in. And in fact, like reliability also doesn't kind of get rid of bias. Like we put something in a manual and then everybody sees it the same way. But if that bias is baked into an observation manual or a protocol, then that bias still exists. So I think it's a great question. And I think it's a space where like we all have to kind of continue to grapple with. And it's a space where we, in our research, we continue to kind of think about those issues and kind of tweak our observation measures, or or stop using certain observation measures, or think about kind of the redevelopment and what it is that we're trying to kind of observe and kind of see, and also kind of what is the impact that we're trying to create.
Amanda, can you also speak to how you're reconciling discrepant data when you have multiple informants? Dr. De Los Rios has asked that question.
Yeah, so the way we do it kind of and that's exactly kind of the point of kind of the having those three different observation tools, is that we expect that data will be discrepant. And we sit down with that data. And so we spend a lot of times kind of creating kind of an assessment system where the display of that data kind of shows up for a consultant and a teacher. But what I will say is, like, we don't come into that meeting with kind of the answers. We kind of come with just the data and kind of walk through, like, here is what the data on the ASPE that you reported on might say about, what you're seeing in terms of a child's engagement with task. And like, here's what I observed in that meeting. Let's talk about it. And so I think part of it is trying not to kind of pick an answer, but like, what is this like? When we take all this data together, what is it that a teacher might see, or questions that a teacher might have that they can work on with a consultant together? So what we've tried to do is not make it kind of a right or wrong answer kind of situation, but like, here are different pieces of information that we can use to try to engage a child and successfully in the classroom.
I appreciate that nuanced approach to being able to incorporate feedback from multiple informants, because kids can behave differently in different settings and with different people. And so that's valuable information to see the whole child. I'm going to switch to some fidelity of implementation questions, but if Anne or Jess, if there's anything you would like to respond to in terms of how you're reconciling different observers' feedback, if you have that, we can talk about that as well. And wanted to ask, how would you collect some of the classroom implementation processes at baseline or prior to randomization, and if that's possible?
We are considering that right now with our development study. So we're definitely we're thinking about if we would do the full fidelity measure, or if we would use some type of an abbreviated measure that's thinking about those. We have like a facilitating features and a use of evidence-based practice rating section that we were thinking about doing that. And I do think that will be important. Understanding what's really going on in the classroom before randomization or before you start your PD is definitely critical. And I know, Anne, we have potentially a plan for some work we may be doing in the future.
Yeah, so I don't really have much to add, but our plan is to complete all of our pretest measures and all of our observations of, using the EBP use tool that we developed at pretest, and measures of quality programming overall too, before we even do randomization, so that we can keep everyone blind. And it also helps with your project management to keep everyone blind on your project, so you have more opportunities for people to assess too.
And to extend on that, Jess and Sam, and we have a question about when you are wanting to think about fidelity of implementation to evidence-based practices more broadly, or not in the context of a specific intervention. Have you thought about that, or are there ways to build flexibility in, or a couple of the questions that have come up?
It's a good question. So, I think one of the challenges in our autism work is trying to find the measurement tools that have been designed for the context that we're working in. And there is an autism program environmental reading scale that's about to be published that Anne and Sam Odom co-authors on. And that's one of the kind of like generalized tools that we've thought about using in some of our practices, and it's kind of modeled after other classroom observational tools in like the Eckers. And that is one piece. I'm not sure if that entirely answers the question. So Anne, maybe I'll hand it off to you if you have other thoughts.
Yeah, so, and sorry, I was reading questions in the chat, so I didn't hear everything, Sandy, so apologies for that. But yeah,
flexibility and fidelity of implementation.
Yeah, so I do agree. Like, it's really difficult to measure fidelity of implementation when we have very specialized interventions that we're all using. And so I think it is important for our field to think broadly about what kind of measures can we use that can cut across different projects and measure quality overall, like Jess was talking about the Autism Program Environment Rating Scale, or APERS. We're hoping to be a broad, it's modeled after the Eckers, which I'm sure many of you are familiar with, as a tool for quality measure. And so I'm hoping that we can use tools such as that can really get at pre-test, post-test, and what's might be happening in classrooms at a broader level.
No, one of the other, I guess, challenges that jump to mind is as we try to do these fidelity of implementation measures in services as usual, or we often call them services as usual, business as usual classrooms, our comparison condition. That has been a huge challenge in trying to figure out, okay, like, when do we say, like, let's say in our middle school study, we're doing group-based social skills interventions and group-based executive functioning, like, what do we measure in the services as usual schools? Like, what's the comparison, and when do we not measure it because there's nothing like that going on? And so that is a huge challenge that I don't think we have answers to yet, but trying to work, I'm sure like many of you, and trying to figure out, like, how do we do that in a comparison condition to say, like, not just differentiation, yes, this intervention and he is here and it's not here, but what is in the services as usual, what's the quality of that's going on? Because, you know, it's sometimes that's really good. There's a lot of teachers that are doing really good things out in classrooms, and we want to make sure that we're capturing what's going on. And it's particularly helpful when you get to the analysis of results and thinking, like, when we have these different kind of response patterns across schools, is some of that related to what's going on, and how are we capturing that well?
That's tricky to have common definitions that apply across intervention and non-intervention settings. I'm going to chew on that a little bit. I hope others will weigh in who are listening in as well. I'm going to zoom out for a moment with a question from Dr. McCormick, and then I'd like to talk about or bring forward some of the questions that are logistical in nature, because there are a lot of things that the experts on this panel have figured out about how to make this work. So let's pull back and have some bigger picture conversations, and then we'll get back to those logistics. So Dr. McCormick is asking about, I think, the utility of the descriptive features of observational methods above and beyond the degree to which they predict child outcomes of interest, and how are you thinking about what makes those observational measures meaningful to policymakers and practitioners? And I'll start with Amanda.
That's a great question, and I can give an example kind of from our own measures, and then I'd invite others to chime in. But like, just descriptively, one of the things that we notice in many classrooms is that positive engagement with teachers at the child level is on average very low. Like, kids spend a lot of time not engaged with their teachers at all. And that is just a really powerful message to give to kind of policy makers and kind of thinking about like what that means. And it's not that children aren't engaged at all, because we can say like they're doing things in the classroom. So I think the other thing about measures of engagement is like, when we have low scores, we have to be thoughtful that kids are doing something all day. So in our measures, what then are we not capturing that they're doing? And I think oftentimes like they're doing useful things that are important for their development, but we've just not captured them in our observation measures. But I do think that that is one piece. And then there's some other data, and I can't remember where this data came from, but it was a piece of information that I've used an observation where it was again around teacher engagement, and it was another study, and it was like, you know, teacher engagement was very low, but it was high for particular kids, and it was almost always negative. Like that's just a descriptive piece of information to when teachers are engaging, it's to correct, oftentimes it's to correct or intervene on kind of potentially negative behavior that's happening in the classroom. So I think descriptively, this information can be really important and meaningful.
Sandy, if it's okay, I'll jump in. So, yeah, I think that for kind of two pieces, for the policy piece in terms of evidence-based practices for students with autism, we know that, you know, there are mandates in place for teachers and schools to be using evidence-based practices and interventions for kids with autism. So that's an important message to get out there. But it's also important to know, how do you use this, especially with all the turnover for practitioners and educators, paras that we're seeing in schools post-COVID. And so the first measure tool that I shared was the basic steps, implementation steps of specific evidence-based practices. And that is a component of our professional development program that we're using with para educators, where they're taking modules that go through these steps very explicitly. They practice them, they talk about it with their teachers. And so there's step-by-step guides. So we link it directly to their work in the classroom and the work that they're doing. So I think centering it around what's meaningful for the students that they're working with, and that will increase their skills and toolbox that they have as educators is really important.
I know we've gotten questions with some of the non-IES work that we're conducting in North Carolina related to social emotional interactions between teachers and children, and our state leadership wanting to know just in the fall, before there's any intervention in that area, are there negative interactions happening? Are behavioral concerns higher now than they were pre-pandemic? And having some of that descriptive data has been helpful for their planning around what the need is and being able to justify it in policy conversations. So I've seen the descriptive observational data be really powerful in that context.
And I think kind of overlaying everyone's comments, and I would echo, is like that, you know, me forcing some measure on policymakers probably isn't going to be super productive, but, you know, more of this research practice partnership or research policy partnership where, you know, you're kind of eliciting measures that are of interest to policymakers. And it's sort of like a productive research loop, right? Where we're, you know, ensuring both producing good research, but also focusing on its research use. And I really like your example, Amanda, of just like basic descriptive work just can be so powerful. And oftentimes these observational tools are really good for that because they're so human-centered in their design when done well. Yeah.
Thank you for those thoughtful responses. Expanding on that, how are you using observational methods to think about what's happening, not just between teachers and children, but between children and their peers?
For our middle school study, we're kind of in the process of developing lunch social engagement probes, so trying to capture them at the times when they're one of the target skills is engaging with peers. So that's a small example, but not one of the ones that's classroom-based, but I do think oftentimes we're focused on like the academic instruction and we miss the in-between times. And maybe that was to Amanda's point of there's other stuff going on that we're not capturing. And so just thinking, yeah, when are we doing these observations and are there pieces that we're not paying as much attention to in some way or another?
Yeah, I mean, the engagement with peers is part of the in-class observation tool. And in that aspect of the in-class is nice because it is like it's positive and negative engagement across like teachers and peers and tasks. And so you can kind of see kind of a global kind of pattern of what the child might be doing during the day. And I agree, like sometimes we're not paying attention and academically around what's happening in peers, and that is helpful because it's in many cases it's an opportunity to see strengths of a child where they are positively engaging. And in our intervention, when we look at that, like it is a piece of data where we can say, look, they're getting along great with like their peers or during this time. And so it's an important piece of the context.
All right, we have 5 minutes left, so I'm going to share some of the logistical and logistical questions and limitations of these methods. And I'd like each of you to perhaps pick one of those to give a quick response to, and I'm going to just name some that I've seen in the chat. There are others. There's been a really rich discussion in the chat and lots of examples for how people are doing this well. So I think there's lots of opportunity to follow up, and I'm really interested in what people have shared. So some of the logistical questions had to do with how are you getting permission for recording with IRB constraints, with the need for unanimous consent in a classroom, and other kinds of concerns that public schools might have versus early childhood classrooms in other settings or family childcare homes. So that was one. How are you training non-expert observers? And one limitations question that I saw had to do with the degree to which the inferences we can make using observational methods are determined really based on some of our sampling procedures and who gets included in our observations. So if you could think through some of those or others that came to mind for you and share one concluding remark, I would appreciate that.
Well, Sandy, you on our work, we've struggled a lot with this question about sampling. And I think part of this is coming from like the study design, which is that oftentimes like when we're designing for like to look at treatment impacts, oftentimes your power is coming from having like more classrooms and fewer kids within those classrooms, which is a bummer for this type of work where you're trying to understand observations within classrooms. It's also a bummer from work if you're interested in doing like treatment impact heterogeneity, like the power differences. You actually get more power from having more kids within classrooms. So I think as a field, we kind of need to consider deeply exactly this question. I think it's spot on, which is like, we got X amount of dollars, like how do we sort of make the trade-offs between, you know, at what point is there not sort of a benefit of assessing every, you know, observing every single kid in a classroom, but is 4 too few? And so I think there's lots of, I'm sure IS is considering this, you know, lots of different questions about, you know, kind of the optimal number so that you really can get kind of a good snapshot of what's going on in that classroom and aren't overgeneralizing.
Thanks, Gary. Amanda, would you be willing to go next? We'll go in order of our.
Yeah, sure. I don't have a very good answer, but I'm happy to tackle the consent question. So I think like, you know, we struggle with this as well. So it's easier to get consent if you're talking about like the interactions between a particular child and their teacher than it is to get the whole classroom. The other thing that I would say is like consent for what purpose? So like when we're trying to consent to use video footage for an intervention and for service, that's much easier than getting consent for like research, which is also easier to get. Like, you know, we'll analyze and use it for research purposes only versus like we need fully publicly consented video that we can like use for whatever purpose we would like and share it with other colleagues. So I think we have different protocols for all those places. And I do think being kind of transparent at the beginning, especially with larger systems, but whatever program you're kind of working in, on what it is that you were using the video footage for, has been really helpful. And that said, we still get, various, depending upon the program or the organization, just kind of how we get that consent, whether or not the organization might already have consent for uses for some purposes or not, just varies. And it is a challenge, but there are protocols and people are do stuff.
It is challenging, but you're right, there's different scenarios. So those are good for people to think through as they're crafting their IRB permissions. I want to thank our participants for joining us. And I know people will need to disperse at this point, but while that is happening, I hope that Anne and Jess can address one final thought that they had about your measurement or limitations with these methods.
Sure. I will try to tackle the non-expert observers. Again, not many answers here, but for our fidelity measures, one of the things we've done with some of our more targeted interventions is we've taken to having indicators for certain pieces or components of the intervention, and doing almost like a checklist approach, and then having our ratings reflect which percentage of the indicators are present or not. And that has helped us with, I think, reliability and helped with coders that may have less expertise. And then we've used a lot. We try to train on videos before we go out to live in the classroom to kind of get them up to speed first. But I think in general, it's the same balance maybe that Terry was talking about, is okay, what's our kind of what's rigorous and what's reasonable. And yeah, we're always trying to walk that line well, and don't always have the answers and always feel like we're making decisions one way or another that impact the science or our ability to get out and do it with the resources that we have available.
I think we need a workshop on this, Anne.
Yeah, so I agree with everything that Amanda said about consents for study participants. Just to add a few more caveats in on it. A lot of times we have to start, of course, with the district level and get permission there for consents, but then we embed it that we are taking consents within our consent and assent forms that we use. So it says very explicitly, by agreeing to participate, the research team will be collecting videos and using those, and only our research team will see them, and they'll be on secure server as well. I do want to note that though we have the assent process for our students with autism as well, and so they have to assent to participate as well. And then we have a separate form that gets at all the other things that Amanda was talking about too. So it's just another page that's added on to our consent process, where they have to explicitly check out for each of the purposes they're okay, whether it's in trainings, training our team, conferences, we do a lot of web-based work as well. So it's also making it free and available on our web servers as well. So thinking about all those different levels has helped us, and then embedding it within the consent form.
Thank you, Anne. Thank you for this rich discussion to our panelists. Thank you to our participants for the great conversation. Our contact information is on the screen if you'd like to follow up, and please do fill out the evaluation form in the app if you have the opportunity. Thanks, everyone.